So I want to talk a little bit about shared decision making in healthcare, specifically in mental health care, and what that is. So shared decision making. It's a perspective that basically places tremendous value on the patient's unique experience as an individual and tries to understand how who you are as a human being comes into the equation of clinical decision making in healthcare. So historically, the role of the physician, I think, has been hyper emphasized in the healthcare setting. And so you have paternalism basically saying, look, here's the expert, the doctor god that you need to bow down to while they're on their pedestal, and what they say is clearly the best decision for you. And why aren't you complying? Non-compliance. I mean, that's one of the tag words, keywords that you should recognize if someone is speaking about compliance or non-compliance. Your flag should go up that maybe this person doesn't see value in shared decision making in the healthcare setting. So in trying to sort out and right this imbalance that has historically existed in healthcare, the idea in shared decision making is that the patient brings their expertise to the table of what it is like to be them, to be this unique individual on a particular journey in life. And none of us can fully understand what that experience is like for another person. But because they are a human being, that their experience matters. Who you are as an individual matters, merely on the basis that you are a human being. And so what I might think as a physician in terms of the best course of treatment for you may or may not be what you decide is the best course of treatment for you. Now, here's how the process, I think, works ideally. When the physician can see their role as educator, as someone who is there to kind of present the information, here's what I think is going on with you. Yes, I went to 4 years of medical school, and so I am the expert on mental health care, and in my case, naturopathic medicine and homeopathy. So I can inform you as to what I've learned about this process of, let's say it's depression or anxiety. Here's what I see. Here's what happens. Here are your options. Here's what you can do about it. Here are the risks and benefits of a particular treatment. But then the goal from the physician standpoint is to back away, to get out, and not manipulate the process, not seek to overly influence the decision that the patient wants to make, but rather to provide information, to try to let go of an attachment to a particular decision that a patient arrives at. There's a brilliant movie, I think it was the early 90s when it came out, called The Doctor. And it really is this story of William Hurt plays the lead character, who is a physician who is on this journey of kind of basically stepping into both roles, right? He starts off, he's a little bit of an arrogant doctor, doesn't necessarily treat his patients with the most integrity. And then he comes down with throat cancer himself. And he wakes up in a different world, realizing how little he understood about what it was like and the experience of being a patient. And it changes who he is and how he functions as a doctor. I think this is a beautiful picture of this idea of this gap that exists between physicians understanding what it's like to be a patient in that role, and thinking, because we've had all this training, that we somehow know. So shared decision making seeks to emphasize equally the patient's role and how important their perspective on uniquely being a human being, how much that matters. And seeks to bring that in, and then also to emphasize, look, okay, this physician is the expert on whatever it is they do, but when it comes down to it, both perspectives need to be weighed in making a decision, and a decision is made together. We'll speak more about this in the future. That's just the gist of really what shared decision making is. It's kind of a philosophy that ought to underline any kind of helper healer care. Feel free to post your comments below. Of course, I love new subscribers and love to hear your comments. So tell me what you think. Thanks.